Today marks the last day of my first week of my anaesthesiology rotation, so I thought it would be fun to do a cute little vlog about what's happened this week as I show you the lumbar puncture or spinal block procedure, where you can also add in anaesthesia to numb the lower half of the body in order to do surgery. So this week has been very productive. We've started at like 7:30 every day and we're in theatres for around 3 hours, just observing the anaesthesiology team and also practicing procedures such as endotracheal intubation, lumbar punctures, which we'll do after we learn this procedure today, and inserting IV cannulas. I've only ever been in theatres before as part of a surgical team, like general surgery or obs and gynae, where we actually observe the surgeries that's happening, but we don't know what's going on like behind the curtain. That's the anaesthesiology team at all. So it's rather intriguing to discover what needs to happen in a multidisciplinary team in order to make the surgery happen. Then after spending the whole morning in theatres, we have some short lectures which are more like case-based discussions, because all of the lectures are in video form that we watch beforehand, and then in class we just have discussions where sometimes it's an emergency case, emergency anaesthesiology, what would you do if the patient experienced hypertension and bradycardia after a spinal block? Could they possibly have a high spinal block, where we need to manage them by elevating their head, giving them oxygen and fluids, vasopressors, also atropine for their unstable bradycardia. Just some really quick cases to get your mind jogging like it's a real life situation. Our case discussions finish rather early in the afternoon, but that's because we need time for our pre-anaesthetic records. So what we do is we check who's the first patient that's going to be getting surgery in the theatres we're assigned to in the next morning, and we go and see that patient. We assess their medical conditions, if they're controlled or not well controlled. We assess their medication, we assess their airway in case they need intubation, and we ask about their past history of surgeries and anaesthesia, any complications. Then at the end, most importantly, we evaluate their risks for the procedures. So that was my first week of anaesthesiology. I'm enjoying it so far. Stay tuned to find out more.